for joining Healthy Women on our IG Live.
Yeah, I'm happy to be here with you guys.
So tonight we're going to talk about sex, and I was just saying I can hear George Michael singing behind me. Let's talk about sex, right?
Yeah.
So I want to give a quick opportunity for you to introduce yourself, Dr. Jamea, and your specialty, and share your specialty.
Sure. So my name is Emily. I am a licensed marriage and family therapist and professional counselor and a certified sex therapist. I'm based in Houston, Texas, and I run a busy private practice, and I also do research, and I write, and I do a lot of interviews and public speaking and that sort of thing. So lots of different things, which keeps things exciting.
I love it. And thank you so much again for taking time to be on Healthy Women. So I can imagine you're busy because I can share with you on healthywomen.org, the Sexual Health Center is one of the highest traffic areas. And I'm sure that's not surprising to you, but I keep thinking, why hasn't that changed, right? Because it's been that way since we launched the health center. When we started talking, and I'll share with you, when flibanserin was getting ready to be approved years ago in like 2009, 2008, we started the Sexual Health Center because of female sexual disorder, or at the time it was called hypoactive sexual desire disorder. And we're still seeing a huge amount of traffic, one of the busiest areas on Healthy Women. Does that surprise you?
Not at all. I think that, sex is still one of those things that most people are doing or would like to do. I think people recognize that having a healthy sex life is good for us as individuals. It's healthy for our relationship, yet it's something that a lot of people struggle with for a myriad of reasons. And so that creates a lot of confusion. When clients come in, let's say complaining of I like to say discrepancy in sexual desire, because I really don't like to pathologize the person with lower desire.
Right.
I have to put my detective hat on, because there are so many different things or combination of factors that may be contributing to the problem. Anything that's going on with us as individuals, anything that's happening in our relationship dynamic, anything that's happening in our greater environment can have an impact on our desire. Anything from our past, our future. I mean, it's all encompassing. And so I think it's something that a lot of people are trying to understand better. On top of that, there's still a lot of cultural taboo around sexuality, particularly women's sexuality. And so I think we're, at a point now in history where we finally have access to more quality information, but we still have a long way to go. So no, I'm not surprised.
No, and so let's talk about our age demographic here at Healthy Women are women 35 to 64. So you're getting perimenopause, right? You're getting menopause, and you're getting postmenopause. And the one thing that I can say that I've been so pleased over the past few years is seeing more FDA approved prescriptions for women that focus on sexual health. And I'm seeing more over-the-counter products too on the shelves for women that are having experiencing some sexual discomfort. Can you talk about the new products that have been, or the semi-new products that have been approved, and your thoughts on them and how women can learn about them? I think that's a big concern too. Most women don't realize there are some prescriptions that are available that can help them, and there's some over-the-counter products that might do the trick as well.
Yeah, so I think for over-the-counter products, I mean, lube is your friend really at any age, but especially through and post-menopause, because what causes the majority of changes through menopause is a decline in estrogen. And one of the symptoms of low estrogen is vaginal dryness. There are other symptoms of low estrogen, but that's one of the most noticeable ones for people when we're looking at it from a sexual health standpoint. And so there's so many different over-the-counter lubes available now. I usually tell people, put on your big girl panties, go down to your local sex shop, and a lot of times they'll have different samples, and you can buy a few and try them out and see what you and your partner like. And then as far as prescriptions go, estradiol seems to be a lot of women's best friend through menopause, and that can be administered in various forms. There are vaginal inserts, there are patches, there are creams. And so that conversation I usually encourage people to have with their doctor. and make sure that you're seeing a doctor who's really well informed with hormone replacement therapy, if that's something that you want to explore. It's not always the case that, you know, the OB who delivered your babies is going to be the best person to help you through menopause. And so you really want to talk to your doctor about how much they focus on this issue so that you're getting the best, most up-to-date information.
I love that. I love that advice. And I couldn't agree more that it's not, you do not, your OBGYN not be the person to help you, you know, as you're transitioning from babies to that next chapter, right? So finding a healthcare provider that stays on top of, you know, midlife health and wellness, sexual health, hormone therapy is so important. And I know one of our colleagues, one of our partnering organizations, the North American Menopause Society, is a great site to visit and to find healthcare providers that specialize in midlife health and wellness. So I want to give them a plug. So how would patients find you? Like, or what's the right time to bring in someone with your background and your
Yeah, so, you know, our sexuality is so much more than what's happening with us physically. And I think a lot of people are inclined to just blame our hormones. But when we take a really comprehensive look at the literature, we find that hormones may make up a piece of the puzzle, but they are not the whole puzzle. So, you know, if maybe once starting hormone replacement therapy or, you know, having your health checked out, no matter what stage in life you are, if you're still finding that you're struggling with low libido or pain with intercourse or experiencing difficulty with your orgasm or arousal that and you and your doctor cannot identify any physiological reason for that, then it's definitely worth it to reach out to someone like me. To find a certified sex therapist in your area, I usually direct people to asect.org. That's AASECT. That's our professional organization, and you can put your state and then look at a directory of therapists near you, and that will ensure that you're getting someone who's fully certified.
I love that. Thank you so much for sharing that. We've got a couple questions coming in from the viewers. Do you mind if I ask you a few?
Sure, go ahead.
Okay. What's the best way to combat loss of libido as we age?
Oh, yeah. So again, libido is super complex. I think the shortest answer to that is to be very intentional about cultivating it. I think that, you know, when we think of sexual desire, a lot of us think of spontaneous sexual desire, that kind of like, ooh, I think I'm in the mood to have sex, right?
Yes.
Well, that's not how a lot of women experience sexual desire, okay? That's more how men tend to experience desire, but a larger percentage of women experience what's called responsive sexual desire, meaning that the desire comes in response to feeling an emotional connection or attended to by your partner, plus a little bit of physical sexual arousal. So a lot of times people are waiting for this spontaneous desire to show up, and they're going to find that they'll be waiting around for a long time. So you want to always assess, okay, maybe I'm not really in the mood right now, but am I at least like open to the idea? And if there's a sense of openness there, again, once the physical arousal begins to build, then you'll notice the desire to kick in. And so it's about being open to, and then, you know, cultivating it, being intentional about it. You know, couples who sustain high levels of sexual satisfaction in long-term monogamous relationships prioritize sex. And so, you know, I think that for whatever reason, you know, we're very good at using our brains to prioritize all kinds of things that matter to us in life, but we put sex in this box as something that should happen automatically or spontaneously. And it's just like anything else. If you want it to happen more often, you have to make the time for it.
So date night is a good thing.
Date night is a good thing. If there's, you know, young kids at home, I'm a huge fan. I've got 2 little kids. I'm a huge fan of date overnights. You know, we don't get to do those as frequent as regular date nights, but you know, if you can coordinate childcare or grandparent to come over and stay with the kids and look for a local hotel deal, just getting into a new environment where, you know, there's no distractions and you can sleep in a little bit in the morning. I think that just gives you more time to relax, because we know that relaxation is usually a precursor to arousal. If you've been like, you know, running like a chicken with your head cut off all day long, it's hard to make that switch into getting in touch with your sensuality. So giving yourself time for that transition can go a long way as well.
Another great tip. Thanks for sharing that. Let's see. How do hormonal changes affect your sex drive?
Okay, so it's kind of complex. So when we're talking, like, I don't know if this person was asking specifically about menopausal hormones.
I'm going to say menopausal just because that's
what we're talking about here.
Yeah, exactly.
Yeah, so with a decline in estrogen comes all the classic menopause symptoms, you know, night sweats, mood swings. It can cause vaginal dryness. It can cause a loss of elasticity to the vagina. So if you're not sleeping well, if you feel irritable, if sex has become uncomfortable for you, you're not going to want to do it. So, you know, it's more that the low desire is happening secondary to some of the other symptoms that you're experiencing. A lot of women just don't feel like themselves anymore. You know, there's changes in body, and so body image can become a concern. A lot of women find that because testosterone goes down a little bit, that they have a harder time keeping weight off or building muscle mass, and that can feel really frustrating. And so that can cause desire to drop. So it's not that there's a direct cause and effect of the change of the hormones. It's just because that shift a lot of times doesn't make women feel very good. You don't want to have sex if you don't feel good. And so, you know, it's, again, that's talking to your healthcare provider about what you can do to manage your hormones if you're a good candidate for that, so that you can still feel your best.
No, that's great. And we just had a question in about pregnancy. And so many of our moms are the advanced maternal age, so that 35 plus. And so during pregnancy, of course, desire there. And then once you have that baby, it goes away again, and you're exhausted and everything else. So I'm just, you know, I think just based on talking to you, I think I can pretend that I'm the sex therapist here. I'm thinking, you know, you're not crazy. You are exhausted. So maybe about a different way of, like, you know, having someone come over and watch the baby and doing date night or date morning, date afternoon. If it's right. Totally. And that's normal, right? Like there is a again, a shift in hormones after you have that baby. So
especially for women who are nursing, you know, all of the hormones that are there during nursing, you know, your prolactin levels are high, your estrogen is low, kind of like a little glimpse into what it'll be like for menopause with that lower estrogen. Right. That, you know, and oxytocin is already high because of nursing. That leads a lot of women to not really feel in the mood for sex. And so what I tell women is, you know, A, if maybe from a hormonal perspective, you're not really feeling it, B, you're just too damn tired, then, you know, there are little things you can do to maintain kind of a slow simmer, right? Whether that's taking a shower together or just laying naked in bed with your partner, making sure that, you know, if sexual intimacy isn't happening, that you're still trying to cultivate some emotional connection where you can find it. But overall, across our lifespan, our sexual desire is not static. It ebbs and flows with whatever's going on in that phase of life. And every woman and every relationship is a little bit different. Having good communication skills with your partner is essential. You know, having a partner and really getting into that adaptability mindset, learning to think outside the box a little bit. I tell people that, you know, the sex you had in the honeymoon stage of your relationship is going to be different than when you're trying to get pregnant during pregnancy, when you have a baby sleeping in the bassinet next to you, you know, later on when you're empty nesters, or, you know, there's all kinds of things that can happen that are going to affect our sexual connection. So, you want to refrain from sticking to too narrow of a sexual script. And what I mean by that is, you know, if you have your idea of we have to do A, B, C, and D every time we have sex, and if the things don't happen that exact same way in that same order, then we're going to get thrown off course. You're going to feel frustrated. So it's important to be flexible.
I love that. So how can people find out, how can people follow you? And I know you're offering a great workshop. So can you tell us a little bit about that?
Sure. So I have an online workshop available now, and it's really about how to maintain a really strong emotional and sexual connection. Again, it's geared, singles can take it too, and I always encourage singles to take it because I think it will do wonders to prepare you for your next relationship. It's also for couples who are wanting to sustain really high levels of emotional connection and sexual satisfaction in long-term monogamous relationships. And that workshop is on my website, emilyjamea.com, and I have a discount code for healthy women followers. So you can use code half off if you're interested in trying the workshop.
And for our audience to follow you, how can they follow you on Instagram?
Yeah, so you can just, once we end our live, you can just click on my name, go to my profile and follow me. I offer like daily physical and emotional intimacy tips. And I do lots of like live Q&As and interviews with other experts, and there's like always something happening. So definitely check that out.
So if there's 3 things that we can tell our audience about how you can improve your sexual health, what would you say?
I would say maintain an open mind, be curious, always maintain curiosity. We didn't talk about that as much, but
that's going to be our next episode.
Yeah, we'll have to schedule another one for that. And really work on that attunement in your relationship. I think that when we're really, I tell people it's kind of like a band of musicians playing together. They don't get good at something because they don't bring their instruments together and practice very often. They get better because they're working together all of the time and creating new melodies. And that's when you can really let go and kind of have a jam session. So the same principle applies to couples when it comes to sex.
Dr. Emily Jamea, thank you so much for your time tonight. Have a great day. And
Thanks,
people
Beth.
log on to follow Dr. Jamea on Instagram, and half off if you would like to join her workshop. Thank you. Have a great night.
Thanks.